I can't, it's not letting me start the videos because the host has stopped it.
Here,
Yes.
hang on.
Give
gotta
me
make her
one
up.
second. There you go. That should fix the issue.
All right, perfect.
There you go. Okay, so I'm going to also unpause our recording for Zoom, just in case anything happens with YouTube. We can upload the recording, but we are now live on YouTube.
All right. Well, welcome everybody. I'm going to call us to order at 5:07 p.m. and this is the September 7th special board meeting of the Altadena Library District Board of Trustees. I'd like to welcome everybody who's joining us this evening, trustees and members of the public and folks on YouTube. Glad to have you with us. We do have a lot of public comment today, and that's great. So what we're going to do here is I'm going to start us off. I'm going to talk briefly about the order of operations for tonight's meeting, and then we'll dive right into it. So we'll begin, as always, with our roll call of our trustees. Trustee Andrews.
Here.
Trustee Capel.
Here.
Trustee Cervantes.
Here.
Trustee Wilkerson.
Here.
All right. We have one whole agenda item tonight, so I think it's unlikely that we'll need to reorder anything. So I'd like to ask for a motion to adopt the agenda as it appears in your board package, please.
I'll move.
Okay, do I hear a second?
I'll second.
All right, motion's made and properly seconded. As with all of our votes tonight and every time we meet on Zoom, we will do this by roll call vote. So Trustee Andrews.
Aye.
Trustee Capel.
Aye.
Trustee Cervantes.
Aye.
And Trustee Wilkerson.
Aye.
All right. Now, we have a lot of public comment this evening, but at the moment, we have no public comment on non-agenda items. That is to say, all the public comments we have received, either from people who are going to speak live this evening or people who have submitted comments in writing, all pertain to our agenda item 4A. So unless there's any change in that, Diego, I'm going to proceed into our new business.
Yes, you may
All right.
proceed. As you stated, all comments have been specific to agenda item 4A.
All right, perfect. Thank you so much. So here's how it's going to work tonight, guys. I'm going to ask our district director to give a brief summary of what we're going to be talking about in agenda item 4A, and then we'll invite members of the public to make public comment. So just so everybody knows the way this is working, folks have had the opportunity to either submit public comment in a written form ahead of time via email. If that's the case and they've said, no, I'd like this read into the record, then the clerk will read that comment into the record. Other commenters have elected to give their comment live this evening on Zoom, so they'll be with us and they'll give those comments live. In both cases, a couple of basic ground rules apply, and I'd just like to take a minute to remind everybody how that works. So first of all, any public comment is addressed directly to the chair. That's me. So we're not having a dialogue. You're addressing your comment directly to the chair. You have 3 minutes. Everybody gets the same amount of time. I will keep the time. If you are in the middle of your comment and we hit that 3-minute mark, what'll happen is I'll ask you to finish your thought, wrap up your remarks, and conclude at that point. So that's going to be the case whether it's a written comment or whether it is an oral comment that we're hearing. So 3-minute mark. And then I'm sure this is not going to be an issue, but I just wanted to remind everybody that we do welcome everybody's opinion. We're delighted to have you with us and to hear what you have to say, but the commentary does need to remain focused on the agenda item, that is to say the policy in front of us. And if at any point, any comments cross the line from talking about the agenda item that we have to anything that is personally defamatory or abusive or directed at any particular member of staff or a trustee, we're going to shut that down. So everything will be respectful. We're all here to listen to one another and hear from our neighbors. So I'm sure, like I said, it won't be an issue, but I just wanted to be really clear that's the tone of the conversation we're going to have this evening. So any questions from trustees on anything before we ask the director to give a staff report? Okay, perfect. Then I'd invite our district director to give a brief summary of this item. Hi, Nikki.
Hello. Good evening, trustees and members of the public, both in the room and watching on YouTube. So as you all know, tonight we're reviewing and potentially approving an ALD COVID-19 vaccination policy. So basically following the governor's policy announcement to require all of the state's school workers get vaccinated that came out on August 11th, staff were asked to put an item on the agenda of the regular board meeting, Board of Trustees meeting on August the 23rd to potentially discuss a vaccine policy for our system. So following that, what I did was email all of the staff on Friday, August the 13th. As the board knows, every time we develop policy, we really look for staff to provide input and feedback in the process and feel bought into what we're trying to do. So I emailed them on August 13th, letting them know that that was going to be a discussion agenda item. No action would be taken on August the 23rd. And if they had any thoughts or feedback they wanted me to provide, or just wanted to let me know how they felt about it, they could do so. We did bring that agenda item to the board on August 23rd. I did provide some comment from staff. I was approached by about 5 or 6 people that gave me their thoughts on it. I did share that with the board. As you all know, there was board discussion, and then staff was directed to draft a COVID-19 vaccination policy by the Board of Trustees. I reviewed several policies of local jurisdictions and drafted a policy to reflect the board's discussion and comments that were made the night of the August 23rd meeting. Once drafted, the policy was reviewed by our attorneys at Best and Krieger for legal compliance. And I also had a meeting with them to review and discuss the policy on Friday, August 27th. Following this meeting, the policy was emailed to our staff once again that afternoon so they could review and provide feedback to me with a deadline of close of business on August 31st. I actually got several comments over the weekend, incorporated those in, and sent an updated draft to the staff so that they again could look at it and provide feedback by August the 31st. And the 31st being the deadline because we had to publish this as soon as possible so that members of the public could also see it before the special meeting was called tonight. So in terms of fiscal impact, if the vaccine policy is approved and implemented, unvaccinated staff would be required to test for COVID-19 on a weekly basis. And based on the research that we've done, just cursory of what we're looking at in terms of cost, what we found is that each test costs anywhere from $55 to about $100. So what we'd probably be looking at is around $1,200 a month. And I'm happy to answer any questions, or I'll just pass it back to you, Katie.
Muted. Okay, thank you so much. That's terrific. So trustees will have plenty of time to ask questions and clarify any points on this with the director after we hear public comment. But at this time, I'd like to invite public comment on this item. I am informed that we have presently, I think, 18 comments that have been submitted. Some of those are live and some of those are via email. So again, for the emailed ones, I'm going to ask the clerk to read those into the record. For each comment, I'd ask that the commenter begin by stating their name, their full name, and then proceed to their comment. And you've got 3 minutes to state your thoughts. And so Diego, I'll ask you to maybe begin with some of our emailed comments, if you would, please.
Of course, I'll go ahead and be reading some of the comments. And just for those that are on our Zoom link, please remain, again, muted and without video until you're called upon. What we'll be doing is reading a couple of written comments and then allowing one real-time person to comment and so forth to allow all comments to be heard by our board. So I'm going to go ahead and start with 2. So the first one is from AJ Guindo, Gudino, and their comment is, as someone who has enjoyed various Altalena Library concerts and has close friends that are employed by the library, I am disappointed and saddened to hear that the library is attempting to set forth a mandate that requires its employees to receive the COVID, quote, vaccine. As you consider whether to mandate the, quote, vaccine, I politely request that you consider the following questions and predicaments. 1, Studies suggest that natural COVID-19 antibodies are more effective in fighting COVID-19 virus than the vaccine. In addition, studies have also suggested that those who have had COVID are at higher risk of experiencing adverse effects from the vaccine. Why then would one require its employees to receive the vaccine without considering the potential adverse effects of some of its employees' unique predicaments? 2, if an employee experiences adverse effects that either hinders their ability to perform daily necessary functions or leads to their death, will the library compensate that employee for those repercussions? Will the library then provide for the individual's family? Can the library take away the pain and suffering of that individual or their family? All in all, will the library hold responsibility for mandating that individual to receive a vaccine when they otherwise would not have received the vaccine? Thank you for your consideration, and we all hope you make the right decision. Sincerely, AJ Gowindo.
Okay, thank you for that comment. Let's do one more written comment, if you would, please.
Yes. The second one is from Christopher Kellermeyer. The comment says, I am opposed to this policy. It encroaches upon free will, and I will not stand by an organization, city, county, state, or country dishing out ultimatums, especially pertaining to what people do with their own bodies. Want to know how an ultimatum feels? If you approve this, I will polish my resume and apply to organizations that respect basic human rights. Those are our first 2 written comments.
Okay, thank you for that. So at this time, I'd like to invite our first in-person commenters. So Diego, if you'd unmute them and start their video.
Okay, our first one, I'm gonna go by alphabetical order because that's how
Right.
it appears on our end. Bridgette, you're up next, and you should be able to unmute now. And please, again, as Katie mentioned, state your full name and then your comment.
Hi, my name is Bridgette Brewster, and I am a resident of Altadena. First, let me say I'm grateful that the Altadena Library District is addressing the need for a vaccination mandate to promote a healthy and compassionate community for all of us. My comments are very specifically to Section 4 of the proposed policy. There is no question that the science of this vaccination is proven to slow the spread of COVID and lower hospitalizations and deaths. I strongly encourage the trustees to consider a very clear mandate that will keep us all safe. I'm opposed to the concept of paying for the testing and the paid time to leave work, get tested, and remain home while waiting for results. What kind of message does this send to the staff members who comply, show up for work every day, taking a risk every day they work alongside those who don't get vaccinated? I think it also bears consideration that our tax dollars are being used to cover the cost of those who choose to put others at risk. I hope you will consider strengthening this section of the policy to fully address your concerns for the health of our library staff and our patrons. Our patrons are made up of the youngest of our citizenry who cannot get vaccinated, as well as the older who are most vulnerable and susceptible. But please know this, whatever you decide tonight, you will have my full support because I trust your decision-making. Thank you.
Thank you for your comment. Okay, let's return to some of our written submissions. So Diego, if you'd like to read the next 2, please.
Our next written comment comes from Erin Kimbrough, and they say, as an employee of the Altadena Library District, I want to state my full support of the proposed vaccination requirement for staff. The library should be a leader in taking the step to protect staff. especially those working with unvaccinated children. Furthermore, a required vaccination for staff members diminishes risk of transmission to people visiting the library. This is sound community-centered policy that affirms the library as a provider and consumer of important information. And that is the end of their comment.
Okay, thank you.
Our next one is from Victor Sojenberg, and their comment says, the proposed policy includes a statement defining the district's primary function as protecting health and safety of the Altadena community while also meeting its obligations to provide a safe and healthy workplace for employees. I would like to remind the board that this is in fact not the primary function of the district. The primary function of the district is to fulfill its mission of bringing people and ideas together. In terms of questions of health and safety, our library has and will continue to follow directions from public health officials. It is very important that the people chosen to make these decisions are the ones that get to make them. I am not qualified to make any decision about what an individual should put in their body. Neither is our director or our trustees. I believe in every individual's right to make their own medical decisions, and as such, I cannot justify acting in a leadership position in an organization that mandates vaccination. The proposed policy does not make the library any safer. With an 85% vaccination rate on staff and 75% community vaccination rate, getting an additional 4 to 5 staff members will not have a demonstrable effect on the level of safety. Please consider that the libraries had close to 4,700 visits during the month of July 2021. That the board would even discuss the concept of requiring vaccination for patrons is highly problematic and a violation of the American Library Association Bill of Rights. I also urge the board to keep in mind the various motivations for not wanting to get vaccinated, such as being medically vulnerable. Sending these employees to get tested once a week is not a safe option for individuals or the employer. You are sending your most vulnerable into the one environment where they are most likely to get exposed to an active transmission of COVID-19 from vaccinated and unvaccinated individuals. That puts the unvaccinated staff member in danger, and it may increase transmission in the workplace. I urge the board to give up the idea of a COVID-19 vaccination policy and to instruct staff to continue following public health orders through ongoing updates to the district's COVID prevention plan. Once again, I believe in every individual's right to make their own medical decisions, and as such, I cannot justify acting in a leadership position in an organization that mandates vaccination. And that is the end of their comment.
Okay, thank you for that comment. We'll return now to some of our live commenters. So Diego, if you'd invite the next person in alphabetical order to make their comment, please.
Our next person is Janelle Miller. So Janelle, you have the floor. And again, if you can unmute and turn on your video, you can go ahead and make your comment. And please introduce yourself.
Hello, can you hear me?
We can.
Hi, good afternoon. Thank you for the opportunity to share our comments and concerns. I've worked in healthcare and medical research for many years as a research assistant, as a research coordinator, as a data quality monitor. So I understand how research works. The key component of research is the informed consent process. This is where a patient is given all the information on both benefits and risks of the treatment and is allowed to make their own choice to take the treatments or not based on what they feel is best for them and without any loss of care or benefits. The Nuremberg Code of Ethics was created to avoid the horrors of Nazi Germany, where victims were experimented on with different treatments against their will. Also, the US Health Department unethically conducted the Tuskegee syphilis study in which Black men with syphilis were lied to and were not given treatment for their disease. These informed consent laws for medical treatment were designed to prevent unethical treatment of people like was done in these situations, and to make sure that the treatment a person gets is voluntary and not forced against their will. Therefore, either manipulating or forcing people to be vaccinated in order to keep their job is both immoral and unethical. Please consider that while the COVID vaccine is meant to be a help, it can also be harmful. The CDC uses VAERS, V-A-E-R-S, the Vaccine Adverse Event Reporting System, to help find out some of the bad adverse reactions that people have to the vaccine. The reports so far show approximately over 650,000 adverse reactions, 56,000 hospitalizations, 1,700 miscarriages, and over 13,000 deaths associated with the vaccine. So while the vaccine may benefit some, it could also cause serious harm or even death to others. It should be a personal choice what risks a person is willing to take for their body and their life. I hope you will seriously consider the above information and not require vaccines for employees. If vaccines are made to be required for employees, I personally would end my support for the library and tell others to do so as well. Thank you for your consideration.
Okay, thank you for your comment. We'll resume now with some of the email comments that have been submitted. So Diego, if you'd like to take the next two, please.
Yes. The next two are, one is from Kylan Cheney, and their comment is, I am writing to urge you to reconsider the policy presented to you as it is written, specifically Section 2, the vaccination requirement for employees of ALD, which is essentially a vaccine mandate by stating that all ALD employees must be fully vaccinated for COVID-19 as a condition of employment no later than Monday, September 27, 2021. There is no need for a vaccine mandate if the district is allowing those who wish to remain unvaccinated the options presented in Section 4 of the policy, in parentheses, testing and masking. The policy before you states that those in the community who are high risk and medically vulnerable, both of which are not eligible to be vaccinated at this time, however, offers no definition for high risk or medically vulnerable, and seems to be contradictory to the CDC's current recommendation of a third dose of the Pfizer vaccine to immunocompromised individuals. The policy states that its purpose is to protect the health and safety of the ALD employees and the public we serve, while the CDC states that the COVID-19 vaccines are effective at helping protect against severe disease and death. The CDC also states that even if you are fully vaccinated, you can become infected and you can spread the virus to others. Not only is this requirement illogical, vaccine mandates have no place in our society and no one, especially staff of ALD, should be subjected to them. The policy states that 76% of Altadenians have received at least one dose of a COVID-19 vaccine and 87% of the Altadena Library District staff are fully vaccinated. Since the data is available, I encourage you to review vaccination rates by ethnicity and see that mandates such as the one you are considering impact people of color the most. In addition, although the CDC has not yet established the population immunity number for COVID yet, a review of other communicable diseases will show that if 87% of the district staff is already vaccinated, it can be assumed that they are at or near a number of vaccinated individuals sufficient for population immunity among staff. In order to keep my comment brief, I would like to encourage the board, staff, and even members of the public to review available data from the FDA, the vaccine manufacturers, and the CDC as sources of important and relevant information. I am urging the ALD board to respect body autonomy and recognize that personal medical decisions should be made by individuals without coercion. Thank you for your time.
Okay, thank you for your comment.
The next one is from Margaret Hatanaka, and their comment states, Dear Altadena Library Board of Trustees, I am writing this letter to show my support for the library's COVID-19 vaccination policy. I appreciate the consideration and work that went into this policy, which will ensure a safe workplace for the staff and protect the health of our library patrons. I believe that the protocols listed in the policy are a logical step in improving the library's safety measures in response to the COVID-19 virus and the deadly Delta variant. By requiring employees to be vaccinated, we continue to minimize the risk for all of us, and the library board will be supporting the health and safety of all who work inside the library facilities, as well as protect our library patrons. One point in the proposed vaccination policy that the library board may ponder is the option for vaccinated employees to also have the opportunity offered to the unvaccinated employees. Free weekly COVID-19 testing on work time. As stated in the proposed vaccination policy, unvaccinated employees may undergo weekly COVID-19 testing for free and on work time. If the board approves the policy, it would be fair and reasonable to also offer this benefit to vaccinated employees who are concerned for their health and have taken measures to protect themselves and others. Thank you, Margaret Hatanaka, Adult Services Librarian.
Thank you for your comment. All right, at this time, we'll invite our next commenter who's presenting a comment live to join us, please.
And that person will be Jonathan Arevalo. Go ahead, Jonathan, unmute and turn on your video if you'd like. And please introduce yourself.
Good afternoon. My name is Jonathan Arevalo. First off, I would like to thank the ALD board and the district director for the opportunity to voice my objection on having staff mandated to be vaccinated. This decision that is being made is very emotionally charged and driven by fear. And this fear has divided many of the staff, patrons, community members, and ultimately the whole country. You cannot make a sound decision based on fear. If history shows us anything, and we should learn from our past mistakes, those decisions made in fear have caused harm to many people. We have monuments dedicated to those mistakes. Dachau and Manzanar come to mind. I'm not an anti-vaccination person. I believe that those who want to get vaccinated, whether it be for COVID or other illnesses, is up to the individual. It is none of my business to find out if they get vaccinated or not. There are laws in place that prevent me from getting that information. We must respect those boundaries. Now, to force a vaccination upon individuals, in my opinion, is tyrannical. Those who choose not to get the vaccine are being called stupid, shunned, ignored, discriminated upon. When a different opinion that is not in lockstep with this form of tyranny, it is dismissed as ignorant, uneducated, or from a different political faction. This is all based in fear. Your decision tonight is to have all staff vaccinated or go through testing. But the end game is to have everyone vaccinated, which also will include our patrons. The door was open last week at the board meeting when a letter was read out to have patrons also vaccinated to enter the building. For those patrons of the Altadena area that are not vaccinated and that voted on the bond measure to support this library renovation process, are you going to deny them entry but just take their money? Are you going to have them tested also? Who's going to pay for it? Have you counted the cost? There are studies coming out every day that are showing that the vaccinated are getting just as sick as those that are not vaccinated with this new strain. Studies just came out yet recently from Israel that show that 95% of the people that were vaccinated got the new Delta strain, and it was transmitted from other vaccinated individuals. That being said, if you want to follow our EDI standards, then everyone should be tested whether vaccinated or not. They're doing that at USC now. If staff is forced to get the vaccine and something detrimental happens to them because of the vaccine, are you going to support their families and be responsible for their financial well-being if something happens to them? My suggestion is the board table this decision until a rational decision can be made, not based on fear, but on truth. As I said before, count the cost. Thank you.
Thank you for your comment. Okay, we'll resume some of our written comments. So Diego, if you'd take us through the next two, please.
Yes. Our next written comment is from Ben Hamilton, and they say, I am writing in support of the ALD COVID-19 vaccination policy. As drafted, this is a common sense policy that is very much in line with policies that are being implemented elsewhere, including by the state of California and the federal government. For those employees that are not vaccinated, the policy is also generous, providing coverage for testing and allowing it to be done during work hours. Accommodations are being made for those that do not wish to be vaccinated, and it is thus hard to understand resistance to this policy. Beyond this, and while I'm aware of the debate surrounding the vaccines, what exactly is the proposed alternative to this policy here? Vaccines are not being required, so is the opposition to the testing? To the extent that there is opposition to this policy, I struggle to understand it. Finally, with a significant portion of the ALD patronage still being unable to be vaccinated, those younger than 12 years old, it is simply irresponsible and dangerous to not have this or a similar policy in place. My wife works for the ALD. She also has 2 young children at home. This policy helps keep our kids safe in the same way that it does the other kids that visit the library. The implications of not adopting this policy and the message it would send to families in our community would potentially cause lasting damage and a loss of trust from those that ALD serves. And that's the end of their comment. The second
Thank you for your
comment,
comment.
of course. The next comment is from Adam Roberts. And they say, to the Altadena Board of Directors, for the entire year of 2020, employees worked safely and successfully within all the guidelines of masking and social distancing. So there's no reason that an unvaccinated person following the same guidelines would have any negative impact on their job duties. Additionally, the current data and studies show that unvaccinated people who have already had COVID have antibodies and strong immune responses. So there would be no reason for a person who had COVID to get a vaccine if they don't want to, as their body already has antibodies to the virus. Finally, the COVID-19 vaccine is meant to help decrease the severity of COVID symptoms, but a vaccinated person can both get and spread COVID to another person. So to require all employees to be vaccinated does not prevent anyone from contracting COVID themselves or spreading it to others. Please review this professional testimony by Dr. Christina Parks and other physicians. Unfortunately, they didn't provide a link, so that would be something that we would do at another time. Regarding the vaccines and transmission, it's a YouTube link. So it's unreasonable to put unnecessary employee mandates to be vaccinated in place, as it will not stop COVID infections from occurring. Please do not start mandatory COVID vaccine requirements for employees. If you do, I will tell all my family and friends not to support the Altadena Library in any way moving forward. Sincerely, Adam Roberts.
Okay, thank you for your comment. All right, let's invite our next live commenter to join us, please.
And that is Mark. Please feel free to unmute and turn on your video if you choose, with an introduction before your statement.
Sure. Hang on a second. Yeah, hi, I'm Mark Parsons. I'm a library associate at the Altadena Public Library. Yeah, I just wanted to read the little thing I wrote, which is to say thank you to the trustees and Nikki Winslow for their diligence in keeping staff safe throughout the pandemic and into the future. My main comment is sort of addressed towards the idea that people will be able to opt out of the vaccine. That's just what happened at my other workplace and other things. So that's the context of what I'm about to say. So my main part of the statement is that I think it should be acknowledged if we have a system where people can opt out, which I think is reasonable. I think it should be acknowledged that vaccinated staff are accepting or bearing additional infection exposure risk on behalf of those staff members who choose to be vaccinated. Now, the risk may be very small, but it is real, and it can have severe consequences for our health and the health of our families. Not acknowledging this will most likely make some resentments happen. Let's just get it out of the way, get it out in the open and move on. I do not mean to suggest that this should be part of the policy itself, just the verbal acknowledgement. And again, I'm making the assumption here, or not the assumption, this is in the context of people can opt out of vaccines. If that is so, and I support that if that's the decision, then I think it should be acknowledged that it adds a little bit of risk to the staff, to people who are sharing offices. We did have a situation where there was an outbreak earlier in the year when a lot of people were away working from home, so they were all safe. But there were people here who were around people who were exposed, who had COVID, and they had no idea. Now, I think maybe that may have been a little bit of a slip up, but it's just an example. Like, let's just let people know, going forward, if we do have the vaccine opt-out, this is part of the policy. We would be informed, so that's okay. I've already heard that from Nikki, but I think if we do have the opt-out, we should just acknowledge that the vaccinated staff are accepting some amount of risk on behalf of the unvaccinated. So that's the core of what I'm saying. Thank you for listening.
Okay. Thank you for your comment. All right, we'll return now to our written comments. So Diego, when you're ready.
Yes, the next one is from Rafi Uredjian. Sorry, for the record, their last name is spelled Euredijian. So their comment states, "Good evening and thank you for taking the time to hear our comments during this meeting and your consideration of our input to the matter at hand. I come to you not only as a patron of Altadena Public Library, since my teenage days in middle school, where an abundance of available literature provided the means to gain knowledge and excel in education, but also in self-study of various trade skills, namely automotive mechanics, construction, plumbing, electrical, and others, which have provided valuable skills to help my family, friends, and the community. I was hired as a handyman for various repairs and upgrades during the renovation of the library in the year 2017, which included the planter platforms, furniture, and custom wood paneling in the conference room. While these experiences have materially impacted my life, what makes this even more personal are some very dear long-time friends who are on staff and allowed me the chance to be hired for these contracts. This brings us to the COVID-19 vaccination policy under current review. The agenda notes state to ensure that the ALD fulfills its primary function to protecting the health and safety of the Altadena community, while also meeting its obligation to provide a safe and healthy workplace for employees. All ALD employees must be vaccinated for COVID-19 as a condition of employment no later than Monday, September 27th. A majority of COVID-19 vaccines are not approved by the FDA, but rather approved under Emergency Use Authorization, EUA, for investigational use only. These lack requisite studies and are not approved medical treatment. The FDA is required to ensure that recipients are informed to the extent practicable given the applicable circumstances, that they have the option to accept or refuse the EUA product, and they cite a website. The exception is the Pfizer 2-dose vaccine, which received FDA approval at the end of August for those aged 16 and older. However, please note, it still mandates emergency use authorization for children aged 12 to 15. A logical question arises as to why the FDA left this age category under EUA. Has enough testing been performed to allow staff members to make an informed decision on whether to vaccinate or not? And if yes, perform due diligence on which vaccine to administer given the scientific research and results. Any compulsory EUA vaccination requirement is a violation of federal law. With the board's vaccination requirement, you are legally limiting employees to the Pfizer product. As citizens of this great nation, should we not be able to choose which medical treatment we receive? Under the 2005 PREP PrEP Act.
I'm sorry, Diego, I'm just going to stop you right there because we've reached our 3-minute mark. So if I could ask you to just wrap up those thoughts and maybe summarize any remaining points, please.
Yes, so it's about another paragraph. Their comment mentions how the EUA vaccines are shielded from liability in terms of injuries or anything like that, since they're technically still experimental. And so is ALD willing to take responsibility to address those medical conditions that may result of using one of the EUAs instead of the Pfizer one? And they are closing with, if an employee is healthy and tested and poses no risk to COVID-19, why force them to receive an injection? And again, thank you for your time.
Okay, thank you for that comment.
And as you mentioned, I wanted to make clear that even though we weren't able to complete, this will go onto the record as it was a written comment.
Thank you. I've lost track of where we are. Do we have another written one or are we back to a live comment?
We have one more written one, I think, because that was a
Okay.
pretty long one.
Okay, let's do one more.
This is from Brianna, no last name, but they comment saying, hello, I've been a patron of the Altadena Library my whole life, and I've gotten the honor to be a vendor / caterer for some of the ALD events. I love the library, and the staff there throughout the years have been so kind, friendly, and helpful to me. But I am here to state that I am against this policy mandate the vaccine to the employees on staff. And your thoughts and hope of mandating it to the public as well. In my opinion, it is everyone's right to choose what they believe in and what they choose to do. This is why we live in America. We may not agree with each other's beliefs, be it political, religious, or health, but as fellow humans and Americans, we are to respect and hear out why others believe different. We're not to force or put people into a corner just because they want to believe or follow what we believe in. It is their legal right to choose. So you mandating and telling your employees and possibly patrons as well that they cannot work or come to the library because they do not believe in your beliefs goes against certain amendments in our Constitution. It's unlawful and does not have the true American values. For some people, they can't take it for religious or serious health reasons, especially since this is not FDA approved and an experimental vaccine. Will you be ready to be liable should anything happen to your employees since you are telling them to take it or lose your job? I understand these times are scary and difficult, but taking the vaccine is not a cure, nor does it keep you from getting COVID-19 again. I urge you to really do research and check statistics of this vaccine, not just what media and others are telling you. Really do your homework and think of what is legally right and moral, not what you feel pressured to do or what makes you comfortable because of your beliefs and agenda without having done your research properly in consideration of others. Thank you.
Okay, thank you for your comment. All right, we'll invite our next live commenter to join us, please.
And then our next live commenter, Michaela. Feel free to unmute and use your video if you like, and introduce yourself before your comment.
Hi, it won't let me undo the video.
Give me 1 second to see.
Okay.
I don't think we can change that. I apologize for that, but you can feel free to provide your comment.
Oh, okay, no worries. Michaela Revelo, good evening. I'm here to talk about the COVID-19 vaccination policy. I do not believe it's right for this organization to mandate workers to take a vaccine and issue weekly testing and even be put on unpaid administrative leave if one refuses to be tested. I believe COVID-19 vaccinations are an individual choice. Therefore, this policy is unlawful and unconstitutional to enforce. I have a question for you to consider. If one were to mandate to receive a COVID-19 vaccination, will the employee health insurance plan provide complete coverage should one experience an adverse reaction or complications? As an employee, will ALD be providing workers' compensation, disability insurance, or other resources if one were to have complications due to the COVID-19 vaccine? In my research, some life insurance policies do not provide any coverage in the event that one dies from receiving a COVID-19 vaccination. Does our policy provide that? It would be detrimental if an employee and or their family files a civil suit against the Altadena Library should an employee suffer an adverse reaction, death, or termination from their place of employment. Now I ask you, how far will you go? First, you start with staff, then what? Are you going to require volunteers, performers, vendors, or any outside company we have to hire be vaccinated? And what about patrons? We have hundreds of people coming into this building daily. Are you going to require staff to take record of every patron's vaccination status? And who's going to be keeping all of this personal information? Can you please explain your obligation to me under a HIPAA law and how you are going to protect personal health information for staff, volunteers, vendors, or patrons, both with respect to your requirement that one receives the vaccination to work or come to ALD. Not only are you opening up yourself to liability, you are also going against what our current EDI team is teaching us. This is from the EDI's guiding document made in July 11th, 2020, and I quote, "The purpose of the EDI team is the Altadena Library is to continually evaluate the Altadena Library District's operations through the lens of the district's values, equity, empathy, and innovation, and guides efforts to discriminate explicit and implicit discrimination that may exist in the district policies, programming, operations, and service models. In addition, part of the EDI's vision is that the district is representative and all and explicit and anti-discriminatory, a safe space for people experiencing oppression, a leader of our community in the facilitating conversations about equity." Are you now saying that ALD is not going to let patrons, vendors, performers, or even hire potential future staff members due to their vaccination status? That is discrimination and segregation. Our mission at the Altadena Library is that the library district brings people and ideas together. You are no longer living up to that mission if you are going to put this policy in place.
I'm sorry, I'm gonna have to pause you right there. We've reached the 3-minute limit, unfortunately. So if you could summarize your remaining points and wrap up, please.
Sure. So lastly, I just say, so I leave you with this question. Who are you going to exclude from the Altadena Library to begin with? Is it employees? If employees, then you have to place that same policy in the community at large. You are going to discriminate and segregate all unvaccinated and keep them from using this library. Thank you.
Thank you for your comment. All right, Diego, let's take our next written comment, please.
Yes, and unless something changes, we're currently done with live comments. That was our live comment, and we'll be ending with our last 3 written.
Okay, sounds good. Thank you.
This next comment is from Michelle Hoskins, and their comment is, "I am the oldest employee at the library. If anyone should be concerned during this time, it should be me. With that being said, I have taken extra steps with my health, so I will minimize my chances of getting sick. Not just from COVID, but from the flu, cold, etc. I have lost weight, I exercise, I eat healthy, and I am taking several vitamins to boost my immune system. By taking these steps, it is not only helping me from getting sick, but everyone I come in contact with. If and when I get sick, I will stay home. I haven't taken a sick day in 7+ years, so I have plenty sick hours. If I answer affirmatively to any of the questions on the daily health declaration form that I complete every weekday, then I could see why I should get tested. But to have to get tested every week, I think it is a waste of time, money, and my sanity." And they finished their comment with quoting our 2020 California Code, Health and Safety Code, Division 20, Miscellaneous Health and Safety Provisions, Chapter 1.3, Human Experimentation, Section 24171, Testing. So the question they're quoting is, what are the testing requirements of the revised ETS? A answer is, employers must offer testing at no cost to employees during paid time to symptomatic unvaccinated employees, regardless of whether there is a known exposure. This is a new requirement. The second point is unvaccinated employees after an exposure, vaccinated employees after an exposure if they develop symptoms, unvaccinated employees in an outbreak, all employees in a major outbreak. Thank you for your time, Michelle Hoskins.
Okay, thank you for your comment.
Then we have 2 more. So one from Paulina Arevalo. Their comment is, members of the board and to the Altadena Library District's director, I am writing you to oppose the proposed policy, COVID-19 vaccination for all ALD staff. I believe the policy is infringing on the rights of employees to exercise their freedom of choice. Enforcing such vaccinations do not guarantee protection from and for the spread of the virus. Nor does the vaccination guarantee protection of any side effects, be it mild or severe or even death. There are studies that support these vaccinations have been counterproductive since injecting the virus in some people have caused ill effects on the vaccinated and also spreading it to others. In my opinion, the policy is unethical, unjust, and unconstitutional to enforce such vaccinations. Each person should make the choice since it is their own body. Both fully vaccinated and non-vaccinated individuals have been noted to contract the COVID-19 virus. Therefore, to enforce weekly testings to only the non-vaccinated is promoting segregation, and moreover, to issue administrative and unpaid leave to those who oppose such testing is discriminatory. Please consider your decisions as highly as you might lose some dedicated, hardworking, and vital employees of the district, and perhaps face legal issues in the future. Thank you for your time. Sincerely, Paulina Arevalo, volunteer of ALD, patron.
Okay, thank you for your comment.
Okay, we have one more. And give me one moment.
Take your time.
Okay. So this comment is from Isabel Briggs and Yvette Casillas. And their comment says, the vaccination policy currently under review by the Board of Trustees at ALD is an entirely reasonable response to current public health concerns and the realities of working in public service. As the two librarians representing Youth and Family Services, we would like to express our support of this policy as a response to the conditions of working with youth and children, a population that is uniquely at risk for contracting COVID-19. There is currently no available COVID-19 vaccine for children under the age of 12. While this mandate is offering library staff the choice to get vaccinated or tested, children that enter our buildings do not have this choice. Therefore, the proposed vaccination policy would provide added protection for children and their families in our buildings and would decrease the chances of transmission or serious infection among staff and their own families. We feel that part of our job requirement to provide public services to teens and children involves a requirement to keep them safe and healthy by keeping ourselves safe and healthy. If approved, this policy would demonstrate to the community of Altadena that this library is committed to the safety of their children by providing a library experience that minimizes health risks. If we agree that ensuring safe and healthy library service is a priority, then it is completely reasonable to have policies which work to deliver that service. We would also like to address rebuttals to this policy, which invoke ideas of bodily integrity and interference with personal liberty and freedom. We strongly disagree. As stated by Lawrence O. Gostin in Scientific American, discrimination is wrong when it is based on irrational reasons or animus, such as discrimination based on race, gender, or disability. The vaccine mandates are simply a tool, and they apply equally to everyone. They do not input blame or seek to shame the unvaccinated. They are intended only to keep the entire population safe. This policy allows for many choices. This policy allows for employees to maintain their personal practices around health and safety, but with small provisions to ensure public safety while verifying vaccination or regular testing on company time with no cost to the employee. Currently, all public school staff in California are required to show proof of vaccination or be tested at least once per week. Additionally, most K-12 schools are requiring students provide weekly negative tests to attend school in person, the same vaccine alternative that is being asked of library staff. The proposed vaccination policy for ALD is hardly different from other public sector policies or even a code of conduct. When you enter a workplace, you make concessions to dress a certain way, to act and treat others in a certain way. The proposed policy asks employees, sorry, I lost my place.
No problem. We'll stop the clock. Take your time. The proposed policy asks employees.
The proposed policy. There, yeah, it's literally the last sentence. So thank you for stopping the time. The proposed policy asks that employees come to work in a certain way, with one of two forms of proof that they are not vectors of a viral disease, especially contagious for children who do not have the choice to be vaccinated. We are making the personal choice to support protecting the vulnerable in our community, the most vulnerable in our community. And it's signed Isabel Briggs, our teen services librarian, and Yvette Casillas, our youth and family services librarian, and a couple of works cited.
Okay, thank you. All right, I believe that's all the public comment we have received at this time. Is there anything else that pertains to this agenda item?
Not in terms of public comment. We have received and read all of our emails and submitted forms that we received.
Okay. All right. Well, thank you to everybody who submitted a public comment or who shared their thoughts with us this evening. We appreciate your participation and your point of view. So at this time, I'd like to open up the floor to the board for some discussion. Obviously, you know, our action item this evening is a vote on whether or not to approve the policy. Obviously, the options are to approve it, to vote not to approve it, to amend it, to table it, kind of the standard options that we have with any policy. So before we ask for any motions to that end, I think I'd like to hear some feedback from the Board of Trustees. And so I'll open up the floor to anybody who'd like to begin. Rushmore, go ahead, please.
Go ahead. Rushmore.
And then Terry. Yeah.
I'll be the sacrificial lamb and go first here. So
Okay.
question for actually Nikki, first of all, for in section 4, where it states third, I guess be starting at the second line. Well, let's start at the top. As of September 28th, all employees who are not fully vaccinated are required as a condition of employment to be tested weekly for COVID and must wear a mask covering nose and mouth indoors and when in a shared vehicle. So I just want to make sure I understand. So those that actually have been vaccinated are not required to wear a mask at the workplace or in a vehicle. Is that correct?
No, right now everybody is.
Okay. So
But
yeah, I would just.
I think we left that language because when the mask mandate was lifted, Cal OSHA came down saying that unvaccinated people had to continue wearing their mask, which I would anticipate being the case again. But we can always remove that language. Yeah, right now it's everybody's required.
Okay, everyone is, and yeah, so maybe we should make sure that whatever if something is adopted today or adopted in the future, that we make sure that's consistent. So it's just not just as those employees that have not been fully vaccinated. I mean, every employee should be wearing a mask. I wouldn't want to isolate them.
Yeah.
So thank you for that clarification. I'll just start by saying this is obviously a very weighty issue. It brings out raw emotions in everyone. I mean, not only as being on this board, but everyone we talk to in our daily lives, and even family members that have differing viewpoints. So I appreciate the passion and the veracity of which people have articulated their positions on both ends of the equation. Where I look at this from a board position over a public service entity, I think it is our responsibility to protect the public to the greatest extent possible. So there was some questions asked to the board to answer that. And one thing that I think that collectively we as a board and certainly the director have to do is to be able to answer that question for any family member with children or elderly or anyone that may be vulnerable. What is the district doing to protect our customers? What are we doing to protect our employees, to create a safe environment for them to work in? I think what Nikki came up with, it could have gone a number of different ways. There are some organizations that absolutely require 100% vaccination, or you can leave the company. Could have gone another route to require vaccinations and have exemptions for medical conditions or religious beliefs with no testing. The problem with that is that you can still have employees that may have a medical condition or have religious beliefs that, and as a result of them not getting vaccinated, could expose other people that are even more vulnerable at the library, both for employees as well as the patrons that that visit the two libraries. The third option, which is before us now, I think really addresses the issue of protecting the constituents and protecting the employees by not mandating, but offering two choices. Those that have already wanted to get vaccinated because that's what they believe that is in the best interest for themselves and their family and friends. There are those that don't believe that the vaccination is for them, and I respect you for that. That's your entitled to your position. But at the same time, from where I sit, I still think that we need to make sure that we are providing a policy that protects the other employees and the constituents coming in. So that's why there is a weekly test. So we're not mandating vaccination, but we are asking for a test so that we can ensure that we are providing a safe environment for everyone that's at the library district. Now, I will share with you that at first I thought that, really I want to make those that don't want to get vaccinated, make them go on their own time and have them pay for the vaccination. I'm not certain that's necessarily, I have to back off on that, because there's people that actually may have medical conditions that makes it not possible for them to get a vaccination, and we shouldn't hold that against them. And I certainly don't want to be in a position for this board or Nikki and the administration to try to figure out, who is really medically eligible and who's not. I think that, I think this is just maybe a burden that we would just have to provide the coverage, and both for time as well as paying for it. I could be, persuaded otherwise, but I think that that's something that we should certainly consider as part of this policy. But I think by and large, what we have before here, and I know it's not easy for Nikki and the management team and as well as the staff to go through this, but many organizations are going through this. And I think that, again, from my vantage point as a public service entity, we have to do whatever we can to ensure that we are protecting those that we encounter as well as our employees to create a safe environment. And this doesn't have a requirement per se for employment, but it gives you for vaccination, but it gives you an option to address to be able to work through the weekly testing to ensure that that you're not positive. And then furthermore, not to segregate anyone, but at the same time, everyone has to wear masks as well. So you're not going to have employees that have tested, have received their vaccinations, and they don't have to wear masks versus those that have not received their vaccinations and they do have to wear the mask. I think it should be consistent across the board. And I would think that alternatively, because there are rare cases, there's some cases where people that do get vaccinations also do get test positive. I can attest that. One of my sons did. And after getting 2 shots, he tested positive once more. So it is possible. So I think that we're going to create this testing policy that perhaps we offer that to those employees that have been vaccinated, to give them the option to get tested if they feel that they need to. If they've been in a situation where they've been exposed, someone tests positive, we should afford them the opportunity as well. Again, keeping everything on the same level playing field. And so there's no discrimination across the board. So I'll end my comments there, but I think that I think Nikki and the team have done a very good job trying to weigh the issues, and I think that for the employees that are watching and those that have provided your comments, I think again with the public service mindset, I think that this addresses the requirement and gives you the option, and we're trying to do so in a fashion that doesn't discriminate, that everyone will be treated equally at the workplace. I'll end my comments there.
Thank you so much. Terry, I think you were next. And then Jason.
Thank you. Rushmore actually covered a lot of the points that I wanted to hear about, but I did have a question, Nikki, for you. I mean, this really isn't a mandate. It's more of a binary choice for our folks. They can either get the vaccine or they can get tested. And I wondered, on the testing protocol that you investigated so far, is there something that, a place now that we can send them? And it sounds like you've done some work on pricing and so on. And I know there's different types of tests that can be taken. I myself have had one with kind of a scrape your mouth sort of a test, and then one with the swabs up the nose, which was more uncomfortable. So I just wanted to hear a little bit more about the testing regimen.
I did just cursory looking, being that policy wasn't voted on yet. So, I mean, there are I couldn't find much in Altadena, to be honest with you. So what my goal would be is to identify probably a testing site in Pasadena where we set up some kind of an agreement or account with them, and that's where staff would go. I don't know if that would mean the same time every week for everybody, or if it would be depending on the person, but until we have a policy in place, I didn't want to spend too much time on a procedure.
Okay, thanks. I'm like Rushmore, and I think that we have an obligation as a public entity to protect everybody, protect our patrons. Can you hear me okay?
Yeah, I can hear you now. We lost you for a second. You said we have an obligation and then it cut out.
Okay. Yeah, my thoughts are we need to protect the public. There is a choice for our employees in play here. And some of the things that Rushmore said, I definitely agree with. I'm going to stop now. I think I've got some problems with my microphone.
Okay. All right, Jason, go ahead.
Thank you. I'm honestly struggling to get my thoughts together here. I spent the weekend crying on my wife's shoulder after losing another coworker to COVID-19 who was unvaccinated, single mother of 4, completely preventable death. You know, I would make a motion that we post a link to a fact checking on our website, but I don't know if the people that would need to read it would. There have been 0 known deaths due to somebody getting vaccinated. We do know that vaccinations have saved countless lives, and we've lost hundreds of thousands of unvaccinated people to this disease. You know, I wish we had this much engagement at the rest of our board meetings, to be honest with you. That'd be wonderful to see. I would actually, though, propose two amendments to the proposal. I'm not sure, Katie, the exact process, but.
So basically we need a motion first to approve the policy, and then we could amend that motion. But why don't you just talk through what you'd like to change, and we can kind of figure out the right way to shape a motion later on and have some discussion about it.
Sure. So one, I do believe that there should be a medical exemption process. There are, I don't know if any of the current staff fall under this, but you know, this policy is going to be in effect into the near future at the very least. There are people who cannot, for medical reasons, get the vaccine, and there should be an exemption process for that. You know, I hear Rushmore. I don't think anybody on our staff are qualified for that, but I would assume that all the money we're paying to have a professional HR service would be able to handle that. The second, I completely agree with the comments that Bridgette made. If this is a choice, Terry made the same comment, right? Like, this is not a mandate. People have 2 choices. If individuals want to choose to not follow the science and you know, not place people's safety ahead of their, you know, personal choices, like, we should not be using tax dollars to pay for testing and to pay for their time off to go take that testing. So I would propose those 2 amendments. As far as, you know, I think there's some, I think I heard Rushmore, I think, ask about if there's an exposure at work or something like that, we are already obligated under OSHA to provide testing if there's a known exposure at work. So that would still be in place, just to be clear. We're talking about people that are making conscious decisions here and have had 18 months to ponder those decisions.
Well, and just to respond to the exemption question, we talked to the attorneys when Katie and I spoke to them about the policy, and The exemption will exempt you from getting the vaccine, but it doesn't exempt you from the testing, the weekly testing. So that's why we didn't put an exemption into place. People can still go get a religious exemption or a medical exemption, but that wouldn't preclude them from the weekly testing, which was why it's not included in this policy.
Okay, that makes sense now.
Mhm.
Jason, just to your point though, and what Bridget brought up, just to clarify is that for those, I think what you're proposing in your amendment would be for the medical exemptions that they would not have to do it on, get the testing on their own time or pay for it. Is that your distinct differential? Let me make sure I understood so we're clear with this, because right now there isn't those exemptions in place, but if we're going to put that exemption for medical exemption, because obviously there's people cannot get tested, can't get the vaccination, then would your proposal then mean that we wouldn't, just for that separate cohort, they wouldn't be required to pay for it or take it, do it on their own time?
I think that's an interesting question. I think in light of Nikki's feedback and further explanation, I'm not concerned with the medical exemption. I do know that other employers that have a process for medical exemptions, at least that I deal with, they are still requiring testing for obvious safety reasons for both that employee and those around them. Yeah. So I think, you know, I would drop that issue personally at this point, but I still feel strongly that outside of that, if, you know, people like I don't know, I just don't feel like it's a proper use of tax dollars to be using tax dollars to.
Yeah. And I totally agree with you, and I'm there with you. I was just making the distinction between those that are making a conscious decision versus that medically can't get the vaccination, and then because I was in the same boat you were in that, but I thought about the medical condition. I was like, well, that's something to consider. I'm not sure if you feel strongly the way you do, you know, and you know, then you introduce the motion. We'll see how we go. But I just throw it out there because there's you would be some ways penalizing those that could for medical reasons cannot get the vaccination, even though they may want to.
Okay. Camila, anything you'd like to voice at this time?
Hi. So I have a few notes. I would like it if when I read the policy and I keep reading it, it's not completely clear to me. And so maybe I'm just not reading it correctly, but I feel like it needs to be modified so that it is clear at the outset about the choice versus the section, I think it's 2, says that the vaccine is required as a condition of employment. And then into section 4, it says that if you don't have it, then you have to do testing. I think that it should just be clear what it's not clear to me that there is a binary choice. And so it's just, I think the way that it's written is a little bit confusing. So I think that any policy about vaccines should make it clear that people have a choice. Because if it's not clear, like I said in our other meeting, I'm not in support of mandating that people get vaccinated, either the staff or the patrons. So I think that it needs to be clear that if you choose not to get vaccinated, that you are then required to do testing. I think that, I don't remember who brought it up, but I think it was a great point that probably everyone should be doing testing, because being vaccinated does not preclude you from either getting or spreading the virus. And so I think that kind of just muddies the water a little bit if we're saying that. I think that the people that choose not to get vaccinated have a higher burden to show, you know, their efforts to protect the public by getting tested. But I I think that that should be clear, that they have that choice, and it's not like you get a vaccine as a requirement of your employment, because that's I think it's important to note that, because in some positions, like you said, Rushmore, like at my job, it's like you get vaccinated or you are fired by September 30th, period. So I think that it makes me a little bit nervous to say that it's a condition of employment without making it clear that your other option is to get tested. So that's just me. Everyone else maybe seems to have a clear understanding of the way that it's written, but I think it should just be said in very clear, bold language at the outset of the start of the policy versus the way that it's written right now. I think that even though I understand your point, Nikki, about the exemption, but I think that it's something that should be written into the policy personally, that people do have the option of either a religious or medical exemption. That is my opinion, that it should still be stated in there, even though what I hear you saying, it's kind of a given, like they don't have to give a reason that they are, choosing not to get vaccinated. They just have to go through testing. But I personally think it should be written in there. I also agree that regardless of if the state or whomever says that, these people can go without a mask, but these people must have a mask, everyone should be wearing a mask. I don't think that it should be like, I was personally very opposed to the way that, things happened June 15th or whenever it was, to say that unvaccinated people, like, you're free to not, or vaccinated people, you're free to not wear a mask. I think that was, as we see, very short-sighted. And so I think that it should just be clear that everyone's wearing a mask regardless of if you're vaccinated, until there is no masking requirement, because you also have people like patrons and whatnot that are coming in, and people who are vaccinated are still at risk. If someone comes into the library, who is positive, it's, for COVID, and they don't know it, your staff are still at risk. So I think that everyone should just be wearing a mask. And then my last note that I had was around testing. And I'm just curious about why the library would need to pay for it, in terms of why wouldn't it be, is it not covered under the insurance, the employee's insurance? So for me, if I go get tested, then, I'm with Kaiser, it's a part of my insurance, like I don't have to pay for it. If I want to go to Hawaii, I can go to Walgreens and get it done, or CVS, I don't have to pay for it. So I'm curious why we would need to use taxpayers' dollars to cover any testing, and why, anyone who is opting out of a vaccine would, ow, buddy, sorry. Anyone who's opting out of a vaccine would not just go through their insurance. And I don't know, that might be a feature of the insurance plan that ALD has, but that is a question that I have. And so those are all my thoughts on this policy.
So to answer the last question, the little bit of research that I did when I reached out to testing centers was that I was then referred to like the business side. Like, I think, if you schedule an appointment to get tested, I believe you have to state for what purpose, travel, this, you were exposed to someone. So I'm still doing research, but I think if you say I'm being required for work, that you would then be referred in a different way, and that the employer may have to like pick up the bill. So if we aren't paying, I don't know if that's something that could still be something that people schedule individually. This has been honestly like the most confusing part of getting all of this set up. But again, I'll have to have more information to come. I just don't know. It may be that the testing sites won't do it if it's a requirement of your job, that maybe your employer is required to set that up for you. The problem for us is it's a very small number. So the couple of organizations or businesses that I got in touch with said, we only work with organizations that have 100 employees or more. So maybe you could like pool together with several other libraries or something to that extent. So definitely more information to come. As far as everyone always wearing a mask or not, I would rather, like, to me, what I would think is we'd strike the language from this policy, because we have a whole separate COVID prevention plan that outlines all of that I update every time that we have a mandate that comes down from the state or the county. So, you know, that's very clear in terms of like the rules around all of the safety protocols. So I'm not sure that this policy is the right place to state one way or the other, if that makes sense. So I think that was a good point on Rushmore's, because if that changes, it's going to update the COVID prevention plan, which is more so procedure and protocols than policy per se.
Yeah, I agree with that. I think it makes sense to remove it from here. I think another kind of follow-up is I've noticed in some situations that when people do get tested, they ask for your, like, some places are billing the insurance, your insurance. So again, coming back to that, I wonder if you have to do more research, if, for example, it is required by, if they have to state that it's required by my job, that they then also provide their insurance information so that their insurance can be billed for that. Because I do think that it is their own personal choice whether or not they want to get the vaccine or they want to get tested. And so anyone that would, you know, not get the vaccine, I think should be willing to cover the cost of the extra effort that they will need to go through to, you know, and so if that means that if their insurance is billed or they have to pay a co-payment through their insurance, whatever that means. But I would encourage looking into like how the insurance intersects with whatever, you know, testing site that they may use, or, you know, if they have to go through their doctor to get that appointment or whatever. Yeah.
Okay, thank you. Yeah, definitely. I mean, I think we would all agree we would like it to be free. I'm just like trying to look at what the actual fiscal impact could potentially be for the district if that's not the case. I do know from talking to people in Pasadena that they were able to set up an outside contract to come in and do testing at their sites, you know, their buildings. And it's, I believe, $55 a test the city of Pasadena is having to pay. But again, they have way more employees than we do. So I'm not exactly sure how we're going to logistically figure this out if the policy does pass, but
I can also ask at my son's school, they have a really interesting setup where they're testing all the kids weekly on site, and they have a contract with a company, I think it's called Flow Health or Co-Verify or something, where, you know, the testing is provided by the school, you know, for all of the kids. And they have, you know, they have a contract with this company. So I can also ask some additional questions about that if you like.
Yeah, I'd appreciate whatever information you can get your hands on. Thank you, Camila.
Can I make a comment real quick?
I saw it. Yeah, go ahead, Terry.
Okay, I didn't know if I was in line. Nikki.
You are now.
I know you did some research with other places. Is there a model emerging in other libraries about how they're handling this, and especially that part of the testing part of things that you could discern?
Not thus far, no. Because the main one that I looked at was City of Pasadena. They put their vaccination policy into place, I believe, in the first week or two of August, and their date is, I think, September 15th. But other than that, I do believe the city of Los Angeles has required all city workers as well. So I could reach out to John Zabo, who's their director. But again, I think the challenge we face is we just have a much lower number. So for these companies to want to like go into contract with us, I'm not sure that that's going to be easy to find, to be honest. But again, there's got to be situations where there's small businesses that are requiring people to get tested.
And a follow-up question is...
Hang on. Go ahead, Terry.
A follow-up question is whether or not that 1 week interval is the time frame that we need. It could be longer than that or a different number of days between testing.
That's been the practice, both on state and more local levels, is weekly testing. I have had some staff suggest that they would like to see twice a week, but the standard seems to be, and I believe when I had Diego do some research, that's the standard for asymptomatic people is weekly.
Okay.
And to a point that was raised before, we still require all staff to fill out the daily health declaration form. And they have been educated that if you were going to answer yes to potentially have been exposed, if you have symptoms, or if you're isolating or quarantining, that they know they're not supposed to come to work, and then they do go on paid time off to get tested. So like that is already something that's happening for anybody that knows they shouldn't be coming into work because of that daily check that we do with everybody. And that would continue.
And that would be the case regardless. Yeah, that's right. Thanks.
Yeah.
I see a hand from Camila. Camila, go ahead.
I had a question that is a curious question. So Nikki, when you say our numbers are a lot lower, what are you meaning by that? Are you meaning your staff numbers or your percentage of staff that are not vaccinated?
Yeah, without going into specifics due to
Right.
confidentiality around
Of
medical, we have what I would say a handful of staff that are not vaccinated at this point. It's just a
Okay.
very low number of people that work for us that would fall under this policy.
So then my next question as a follow-up might be, you may not have the answer to, but I'm curious about people, like if you are aware if those handful of people are not vaccinated because of maybe more medical reasons, or because they were waiting for FDA approval, or they are, I don't trust it, there's not enough data, because I wonder if, perhaps you might need a policy anyway, but then I'm thinking again about my son's school and that they don't need one because 100% of their staff are already vaccinated. So is there any kind of bridging that is going on with those handful that are not, to understand why they are not? Because, could they be not necessarily persuaded, but is it something that, do they need more facts? Like Jason was saying, like to understand what the concern is about the staff that you have that are not vaccinated, again, without going into any, like a whole bunch of confidential information, because, for like at our work, they had, a town hall to be able to talk to people to understand like what was the issue about, not being vaccinated, so that maybe having a conversation with them could alleviate some of those fears or concerns. Or is it just like, I'm not putting that in my body? So I'm just curious.
Well,
That makes sense.
It's a tough one because I'm not allowed to ask. And I wouldn't say that most have been forthcoming for the reasons. And, I respect their choice to not be vaccinated, and if they don't want to talk to me about why, then they don't have to.
I figured as much. I was just curious, especially since it's a low number or handful, as you had stated.
Yeah.
Okay.
Okay, so at this point, I want to kind of sum up what I've heard from everybody and identify what we need to hash out. So it sounds like what I'm hearing is there are a couple points of clarification that we would like to maybe address in the language. One, Camila has suggested that in section 2, there be some clarifying language about the sort of set of options that people have to either comply with the policy, or if they choose not to, then to be tested weekly. The other suggestions that I've heard have been around basically who foots the bill for that, right? Is the district paying for testing? Are individuals doing it on their own time? Does it happen on work time? Does it not happen on work time? is testing something that's only available to those who are unvaccinated by the date this policy would go into effect, or is it available to everybody? Those are the main points that I've heard some discussion on. Am I missing any other points that anybody would like to hash out?
The only other thing I remember, Katie, is striking the language about wearing masks. About,
Yeah. Oh, right. My understanding was that it wasn't going to be necessary to add language about masking because that was covered in the.
Yeah. But are we going to remove that sentence from section 4?
Let's see. What does it say in section 4?
Just that and must wear a face mask covering nose and mouth indoors and when in shared vehicle. Because I do think like the policy does refer to the COVID prevention plan in places. So I think that's more relevant there, because otherwise like we'd have to update this policy when any masking changes were made as well.
Sure. Okay. Well, maybe a solution is to amend that sentence. I'm going to throw this out there for everybody. Required as condition of employment to be tested weekly for COVID-19 and follow all provisions of the district's COVID prevention plan.
Yeah.
Right.
Mm-hmm.
That way, when it changes, we can, take that into account. Does that work for everybody on the mask piece? Okay. All right. Let's talk about the choice piece, and then we'll talk about the pay for piece. Okay. So I'm looking at section 2, vaccination requirement. And so I'm going to see if I can maybe suggest some language here. So we've got the as a condition of employment, you have to do this by no later than this date. If you need an extension for some reason to the deadline, a 2-week extension can be granted at the discretion of the district director. And then think about booster shots. I suppose we could add a sentence that says something like, should an individual, for whatever reason, elect to remain unvaccinated, because I guess my thing is like we would want to know when people's status changes, right? So should an employee, I'm making stuff up here, but basically if an employee indicates that by the deadline their intention is not to get vaccinated, they should just submit that in writing. I agree that I'm not particularly interested in adjudicating why. I don't want to know why somebody doesn't want to get vaccinated. I don't think it's any of our business. I don't think it makes any difference in the way that we're asking people to participate in a public health process. So I would just say if by X date or the extension date or whatever, somebody intends not to be vaccinated, they should submit that in writing. We could even create a form for it. It can be very simple. And at that point, they would be subject to the provisions of section 4.
I mean, I think another way we could approach it is just so the line that says all ALD employees must be fully vaccinated for COVID-19 as a condition of employment no later than Monday, September 27th, 2021, or be tested for COVID-19 on a weekly basis, parentheses, see section 4. Because I think
or comply with the provisions as set forth in section 4 of this policy.
Is that kind of what you were looking for, Camila? It's like either you do it or
I was thinking that it would look like and sorry, I stepped outside, so I don't have the policy in hand, that as a condition of employment, all ALD employees must and then give them the 2 options. That's how I'm thinking about it in my head, but it doesn't matter how, just as long as it's clear that they have the 2 options, and it's not saying that you have to get vaccinated or you're going to lose your job. You have to do one of these 2 things in order to work in this space with other people.
That's correct. Yeah, I think that's the intent of, that's absolutely the intent of the policy. So I think the wording you suggested, Nikki, maybe could you read that back to us?
Yeah, so what I was thinking was So end of first sentence of section 2, all ALD employees must be fully vaccinated for COVID-19 as a condition of employment no later than Monday, September 27th, 2021, or be tested weekly or receive a negative COVID test on a weekly basis, parentheses, see section 4.
Well, they don't have to receive a negative test. They just have to get tested. Like it's not like you're going to get fired if you test positive. It's, you have to continue your employment, you have to either be fully vaccinated. Okay, what about this? To ensure that blah, 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 all ALD employees by no later than Monday, September 27th, 2021, must either, bullet point, present proof of full vaccination, or be subject to weekly testing, basically until, you know what I'm saying? Like, because maybe somebody's in the process of getting vaccinated or whatever.
I think that the language that you used, either of you used early, comply with the requirements put forth in section 4.
Yeah, that probably is easiest.
Yeah.
Okay.
Okay.
Does that work for everybody? That addition, I think it's a clarification. I think that's what the policy is saying, but I agree with you, Camila. I think it's useful to clarify it. Okay, so masks, we sorted that out. Either or kind of policy clarification, we sorted that out. So the last point of discussion is basically who pays for it and to whom is testing available. And I'll share my thoughts on this. Like, obviously, I'm in favor of this policy. Obviously, I think we should do it. I guess, in thinking about this, I've kind of gone through 2 different trains of thought on the who pays for it, to whom is it available question. And the one is the one that's been articulated by several people this evening, which is basically like, well, it's your decision. So why should the taxpayers pay for it? Why should we use tax dollars to pay for something that you're electing to do? I understand that. The other thought process that I have gone through on this is one that I think goes back to some of our core values and some of our goals, which is to basically to be good neighbors, to be empathetic, to be curious and compassionate, and to sort of set everybody up for success in the best way we can. And for me, the goal is not to be right about a particular point of view. The goal is to keep everybody as healthy as possible, as frequently as possible. And I think it's obvious that there is no one perfect solution to the public health crisis we find ourselves in, right? Vaccines do not solve everything. Masks do not solve everything. Social distancing does not solve everything. But as the CDC has pointed out, like a layered approach, stacking all of these things one on top of the other, does do the most to keep people safe. And so with that rationale in place of like, what is our actual goal with this policy? Well, my goal with this policy would be to keep everybody as healthy and as safe as possible the greatest majority of the time. And so to that end, it seems to me that like we have the ability to pay for testing. Like, obviously, I think we should set up testing in whatever is the most like fiscally responsible way to do it, that saves taxpayers as much money as possible, but we can afford to do it. And furthermore, I kind of think it's true that like if folks who are on staff that are unvaccinated are, having testing covered and can do it during work hours, I think that should be equally the case for vaccinated members of staff. I think that, crunching the numbers, having every single member of staff vaccinated every week does really start to add up. And certainly we have those protocols in place if people think they have a reasonable belief of exposure. But I kind of tend to the point of view that as many barriers as we can remove to getting people tested on a regular basis in a rigorous and time-sensitive way, let's remove those barriers. It doesn't represent a huge hit to our budget. And so for those reasons, I would be in favor of the district paying for it and making the arrangements and having those arrangements be available to all members of staff. It's required for members of staff who have not presented proof of vaccination by the date that the policy is implemented, but should vaccinated members of staff wish to take advantage of that for whatever reason, I think it should equally be available to them. Camila.
I was just gonna comment that I like that. I think it feels good, because I feel like, you know, as I think on it more, it feels kind of like a punishment, which maybe feels mean, like, you know, you chose not to get vaccinated, and so you have to pay this extra money, you know, and it feels, I think it could feel judgy. So I think that so I just wanted to say that I would agree with that, what you're saying, Katie.
Yeah. I guess my only point would be, in terms of a vaccination policy, making those same, like the way the policy is written right now, basically says, if you are fully vaccinated, you don't have to get tested weekly. If you have not presented proof of full vaccination, then you do have to get vaccinated weekly. And that's basically, the district is figuring that out and picking up the tab for it. I don't know if, like, I think it should be the position of the district to also make that same service available to vaccinated employees. I just don't know if that necessarily belongs in this policy or like in our COVID prevention plan. Do you know what I'm saying? Like, because it's not really a vaccination issue. That's like a testing and, you know, kind of prophylactic measure.
Yeah, I was thinking about that, just as in that, is it required for us to state at all? Like, does it have to be hammered out in the policy, you know, who's paying for it?
Well, I don't think so, in the sense that, like, I mean, and I know that this was part of the discussion we had, was that like we would have to figure this out. But in the policy as it currently exists, it basically says, where's the thing about, Nikki, where's the line about like folks have to get tested on a weekly basis in following a process and timeline determined by the ALD, right? So that's in section 4, basically. And that way, if like availability changes or we can find a better deal, or, you know what I mean? I think it is important to build in some flexibility, because I think, you know, stuff is going to change. And I think obviously like our obligation is to be as responsible as possible with taxpayer dollars and get the best deal we can and find the safest option for staff. And I think that is all true. And so for that reason, I would be comfortable leaving the language a little bit vague, following a process and timeline determined by the ALD. That to me seems consistent with our other policies that have allowed a certain amount of discretion to the director for sort of how they're operationalized.
Right. I mean, it's procedure, not policy, because like if something changes, I think like paying or not, or having it on paid time or not, is something that should be written into the policy. But like in terms of procedure, that's why we didn't get that specific, because I can't even tell you exactly right now what it's going to look like, but we'll figure it out.
Right.
So ultimately,
Nikki, what's your opinion though about the whole like things being available to, like the same provision being made accessible to vaccinated members of staff? Do you think that would belong in this policy, or would it belong in the COVID prevention plan? Sorry, Reshmar, I saw your hand. I'm going to come to you next.
I don't know. It's tough because like we've just been very, very, very lenient with anybody that was getting vaccinated, tested. If you thought you had symptoms, you know, and I don't see that changing.
Mm-hmm.
Are we going, I mean, I guess the question becomes like, are we going to commit to allowing vaccinated staff to get tested weekly if they so choose?
I mean, I feel like we probably should all things considered, you know what I mean? Because the rationale is basically like, this is another important component of good public health, like vaccination is one and testing is another and masking is a third. So I kind of feel like, yeah, we probably should. So maybe the solution to that would be just to add in parentheses in section 4, COVID-19 testing will be provided to employees in parentheses, regardless of vaccination status at no cost during work hours following the process and blah, blah, blah.
Yeah, I think we could even remove, like, if you look at section 4, get rid of the word unvaccinated from the title.
Yeah, yeah.
And face masking, I just noticed that too.
Yeah.
And then just provide like language in there that I think we keep it, those that are not fully vaccinated, they're required. And then I could add a line about vaccinated staff that would like to get tested may do so as well, or something like that. Or all employees, or something like that.
Yeah, that seems probably pretty reasonable. Rushmore, go ahead, sorry.
No, it's along the same lines, and I realize we don't have the economy of scale that Pasadena does, but I mean, what would solve this problem, you know, that we're grappling with over like time spent off campus to get this thing done on library time would to have the testing done, you know, at the library if that's possible. So I mean, I'm not sure if that's something we can piggyback onto the city of Pasadena contract that come up to our facility. I mean, that may, since they already have something in place, I mean, that may be something to pursue. I don't know if that would be even a viable option, because that would really kind of solve the problem. Doesn't this, because if the intent is to offer it to all the employees, irrespective of their vaccinated status, I think that would, I mean, it just addresses it so much easier for us from just a fiscal standpoint, and versus trying to isolate one cohort versus another. So I think that's something we should probably pursue, if possible, have them come to.
I already asked. And I was shot down, but we'll continue to pursue.
All right, I figured you would.
Okay, so yeah, I'll add a line in there about all employees can choose to be tested, you know, if they so choose to, or something like that.
Yeah, I just want to make it clear that like those who have not presented proof of vaccination must be tested.
Mm-hmm.
And then, you know, all employees, basically it's something along the lines of like any vaccinated employee is, you know, welcome to be tested once a week as well.
Mm-hmm.
You know what I mean? Because we don't necessarily want to be on the hook for everybody going every day. I think that's a little unrealistic.
Yeah.
Wouldn't it make
Jason,
sense?
I saw it. Go ahead. Yeah.
For the employees that are already vaccinated, wouldn't it make sense to at least double check whether or not our insurance covers that before we write into the policy that we're going to be paying out additional funds for testing that may already be covered?
Well, we're not saying we're paying for it. We're saying it's available to employees at no cost. So that may be because their insurance pays for it. It may be because we pay for it. Basically, all we're saying in this policy is the employee is not on the hook for it.
Okay.
Yeah.
Any other comments on any pieces? So we've identified those three amendments to the policy, and I will do my best to enumerate them, namely in section 2, to add clarifying language, indicating clarifying the intent of the policy. Within section 4, to remove references to masking and instead make reference to the COVID prevention plan. And also in section 4, to add language indicating that members of staff who have presented proof of full vaccination may if they wish, also take advantage of the once a week at no cost on work time testing scenario. That was sort of inelegant, but I think it basically covered it. Camila, go ahead.
I had a question for
Yeah.
Nikki about even section 1. Sorry, I was curious about the what's the word I'm looking for? The kind of the purpose of it, which I know the purpose section is usually to explain why we're putting this policy in place, but then it felt a little bit busy and wordy in terms of maybe over justification of why we need the policy. And so I just wanted to just throw that out there to find out what was the goal of section 1, because it's very long.
What I would say to that is it was based on other policies that I looked at and mimicked some of the purpose around that, just to make it clear, like a little bit of the background and history as to what got us here and why we feel like a vaccination policy is important. I agree with you. It is wordier than many of our policies, but we just felt like, being as thorough as possible was important.
Yeah, I thought like the history piece is, I don't know how the rest of you feel, but I don't know. I don't feel like it's necessary to be so wordy. So yeah, I don't know what everyone else thinks, but I think it could be slimmed down a little bit.
Is there a specific part you want to suggest cutting? Because if we're going to vote on something, we gotta have a specific thing to vote on. So I want to make sure I'm understanding.
Hold on, let me get my glasses. 1 second, let me put the flashlight on.
I mean, I could see if you really wanted to cut some stuff. I mean, it doesn't bother me that it's in there, but if it feels problematic to you, I could see cutting everything from recent updates supporting this information all the way through to blah, 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 indicates that people who are fully vaccinated are less likely to be contagious, and then just like have the continued increase. I don't know. I mean, I don't know that it presents a problem other than like just stylistically. But
right, exactly. That's what I was gonna say. It doesn't present a problem. I just, especially if no one else has any objection to it, I just thought it was a little bit long in terms of explaining. And maybe also I'm just like, it's kind of obvious why we need why the policy in place, people are pretty aware of it, but yeah, it's fine. Sorry.
Well, it shows you appreciate my normal brevity, I guess, in the policy. Huh?
Yes, absolutely.
All right.
Katie,
then at this point, go ahead, Jason, please.
So I'm just just a process question.
Yep.
So we're trying to kind of finalize this, but after there's a motion to approve, we still have an opportunity to make a motion for amendments, correct?
So I think from a process point of view, and actually you've presented the perfect segue for what I was going to say anyway, so it's ideal. I think that at this point, the motion would be a motion to approve the COVID-19 vaccination policy with 3 adjustments, namely the clarification of intent in section 2, the removal of the mask language in section 4 and the substitution of reference to a COVID prevention plan, and the insertion in section 4 of additional language indicating that while once weekly testing is compulsory for all unvaccinated employees, it is available on a voluntary or as needed or like on demand as an option basically for vaccinated employees. So those would be the three adjustments. I know that's not specific language, but I think it's close enough to get the job done. So that would be the motion. Yeah.
As a follow-up to that though, I'm curious why we would approve it or if it's not done. Like why would
because
we wait
right
to approve it when it's all finished?
Because that would push the timescale back, right? So we could do that, right? The other option is to send it back and say, let's bring this back at the regular September board meeting or call another special meeting and approve the policy in its amended form. But I think if we were to do that, I would personally have a hard time seeing an implementation date of September 28th, right? So the sort of timeline spelled out in the policy is one that's somewhat time sensitive. And it says like all this has to happen by the end of September. Well, our regular board meeting is not even until like the September 23rd. So I think it would push out the implementation of the policy by another month, realistically. So that would be the rationale for doing it that way this evening versus bringing it back, but we certainly can bring it back as well. We can also call another special meeting tomorrow. No, we can't. Well, I suppose technically with 24-hour notice, but we could call another special meeting in the very near future and look at it again. So that's the other option, is to do another special meeting sooner rather than later, and look at an adjusted set of an adjusted policy with adjusted language. So yeah, Terry, go ahead.
But Katie, we have done it this way before, where we had a motion and there were some changes that were made in the action item. It was a motion to approve it, and we approved it, you know, understanding that those changes would be embedded in the document or the policy when we were done.
Yeah.
So this isn't new. We've done this before.
Yep, it's a standard process, right? So it's not unusual for us to approve a policy or a resolution or whatever with the amendments indicated. That's a pretty normal procedural process. It's a normal option.
And I think another thing we could say is that we'll bring it back to the board at the September 27th meeting as an informational, like, so you can see it as it's published type of thing, you know. And then if at that point any other changes need to be made, we could always like make it an action item again to make some other adjustments. Yeah, I think that's a good point, because remember, like, we can always change a policy, right? We can change a policy any old time we want. We just have to bring it to the board. So I think that might be a good middle ground. Like we could take a motion to approve it this evening with the amendments indicated. We could bring it back as an informational item on the regular September agenda. And then should there be some major issue where we wanted to enact some further adjustment to policy for whatever reason, we could at that point follow the same process where we either call a special meeting or agendize it for October. What do you want to do?
I want to do that.
You want to do that? Okay. All right.
Described.
Okay. All right. Does everybody feel comfortable with that approach? Mila, does that work for you?
Quite honestly, it's not clear to me what that is. Can you repeat it?
Sure. So what the idea is the process would be that we take a vote to approve the policy this evening with those 3 adjustments that we've outlined several times, those 3 amendments. We include the approved policy as an information item on the September agenda so that we look at it. And then if for some reason during the September meeting, we decide, any of us, that we'd like to make a further adjustment, we could then either call a special meeting to do that and make another policy change, or we could agendize that for the October regular meeting. And that's true for all policies anytime, right? Like if anybody says like, I think we should change the whatever policy and I want to see it on the, September agenda, like that's totally available anytime. Does that make sense, Camila? Okay. Okay. All right, cool. Rushmore. Yeah, go ahead.
Yes, I'm very comfortable with that approach that's been outlined moving forward. And, we can make amendments to the approved policy, but I think it would be helpful for us is that between now and that time that we see it as an informational item, that Nikki can do a little more research as far as what available options we have for the vaccination and the like, because we're leaving that piece of the conversation kind of out of the policy for right now. So I think that that's still to come as far as how Nikki is able to identify this, or if it's off campus and what the cost is, and trying to figure that part out. Because I think there's still some lingering thoughts among some of the board members that that this should be paid by those employees. So I think it'd be helpful to have that little more information when we have that as an information.
Right. So I want to just address two things you said. One, the policy does specify, the policy we'd be voting on tonight does specify that for unvaccinated employees, weekly testing is made available to them at no cost. So that is baked into the policy as it stands.
I know.
However,
I know.
yeah, okay. I just wanted to be
that,
clear on that. Okay. Yeah. But I hear you on the piece of like, we'd like more information as to like what that looks like, how much it costs, what's the deal. I think, Nikki, do you think it's reasonable to include that as either part of your director's report or an information item for September regular meeting? I mean, that's sort of the goal, right? Is that we would have all that ironed out by then anyway.
Oh, for sure. I mean,
yeah,
this policy as it's written would go into effect the day after the next board meeting.
Right.
So, yeah, I would definitely have all of that information to share. And it will be at the top of my to-do list.
Does that work for everybody?
yes.
Okay. Then I think we're ready to ask for a motion to approve the COVID-19 vaccination policies with the amendments that we've outlined tonight. And I've said them so many times that I'm not going to say them again, but there are 3 of them. And it's the thing, I'm going to say them again. It's the thing in section 2, clarifying the intent, the removal of the masking piece in section 4, and the replacement of the COVID prevention plan, and the indication that no cost weekly testing is to be made available to all employees, compulsory for unvaccinated employees, but available to those who are vaccinated. So I'd ask for a motion to approve the policy with those amendments.
I move that we approve as stated.
Okay, very cool. Do I hear a second?
I will second.
All right, motion's been made and properly seconded. Any further debate or discussion on this item?
I just want to be clear that I am not comfortable with language that this is on work time. I mean, we're writing a blank check here. Like, is it 10 hours a week? Is it 30 hours a week? Right? Like, we're trying to expand hours here and we don't know what this is. Like, I'm not okay with that.
You're not okay with what? With
the testing is on work time, and that, I'd be fine if number 4 said that testing is free of charge, is testing should be at the employee's expense unless covered by the employer providing insurance. And it should not be on work time. If we want to have that as a separate issue in the future, after we've researched it and we know, are they driving to Pasadena? Are they driving to Burbank? Like, how many, but I'm not comfortable with writing a blank check tonight on that issue.
Do you feel like the language in the policy that says following a process and timeline determined by the ALD is insufficient to exert that kind of oversight?
I just fundamentally don't believe that it should be on work time, especially when it's a choice that people are making. I mean, we have hundreds of thousands of healthcare workers who do not have this benefit in this state. And they work in ICUs and all that stuff every day, and they do not have the ability to on work time go and get tested. So I don't know why we as a library, a small, independent, limited resource library, are taking that step. It's not that I disagree with some of the premise behind it. I just don't think we have that ability. We're not LAUSD where we can open up testing centers in the school and the teachers can on their break walk down the hall and get tested. Like, we don't have that ability. We're not going to have that ability.
Okay, so obviously making that adjustment would be a fourth change to the policy. So I guess the question is, how do you all feel about that? Do you want to amend the motion to include something to that effect or not? Yeah, go ahead, Raj.
I would be comfortable supporting that, but I would bake in an exemption for those that can provide a note from a doctor saying that due to medical conditions, they are unable to get the vaccination, and so that they would not bear the cost. Other than that, I'd fully support the employees paying for it.
I mean, it's okay for us not to have a unanimous vote too. Like,
No, that's totally fine. But I think the vote is whether or not to approve the policy. So, you know,
Katie, if I may, Jason, you and I we have very similar thoughts on this from a fiscal standpoint, and just that's our position. I think that we can approve the policy tonight as has been read into the record, and we have the first and the second motion. I would say that the report back, I think that I'd like to get information. Like that's why I was asking Nikki to get that information, because I really want to find out what that looks like. I mean, if it can be done on site, that's great. If we have to have them, drive downtown LA to get it done, 2 hours round trip, no, that's not acceptable. So I see that the necessity to move forward on this to ensure that we meet this timeline. But I would like to have further discussion about what this looks like, and I don't think that based on what we've heard tonight, our director doesn't have sufficient information for us to really make a definitive decision on that part. So I think that we would be voting on the policy for its intent. I think there's still that lingering piece that I would like to get more information on, Jason, and perhaps that's something we could that could be introduced at a late, once we get that additional information to make amendments at the next board meeting.
yeah, and I think I see you, Terry. I think from a process standpoint, the other thing that we could do is we could, I'm just thinking about how to agendize all this so that we can do what we want to do in the time frame we want to do it in when we have the information we need. We could vote on the policy tonight as it stands, and we could bring it back as an item of unfinished business and vote on and make any additional amendments or adjustments to that policy at our September board meeting. I mean, obviously that would impact the implementation, right? So if we decide at the September board meeting that something totally different than the policy originally envisioned would be the case, then we would obviously have to probably change some of the dates as well, and that's fine. But I think that's a slightly more robust version actually than just bringing it back as an informational item. And we could also take no vote. We can take no action, right? We can always do that. So if it turns out when we have more information at the September board meeting, if we're like, yeah, that seems fine or whatever, then we could take no action on it as well. I don't know how that would be one option. I saw Terry and I see Camila.
Yeah, I just wanted to, it seems to me that as long as we don't put the language in there that's specific to testing in this policy, we have another policy that we have to do, and that would be what the Altadena Library District deems the policy for, COVID testing. It's almost a whole other subject. So to me, we could vote on this the way it is with the changes that you've recommended, that we've all recommended, but carve out as everybody seems to be saying, the steps on what the testing actually is at the next meeting. So that's one way out of it right now. Because I agree with, the fundamental thing is that I don't think any of this money for testing is misspent from a taxpayer dollar point of view. This is the safest thing that we can do. This is a health and safety issue that's bigger than anything that we face. So for us as a library to open up our purse strings to make sure that that's managed properly is the proper thing to do. But the details of it and so on, if they need to be worked out, it could be done in a policy that gets presented at the next meeting, where this one could go forward the way it is to meet certain deadlines if it gets passed, to meet certain deadlines that we're working with.
I think I agree with that. Camila, go ahead.
I'm curious about the deadline. I know it's September 28th, and is there some reason why it is that deadline that I'm not aware of? I mean, I know for people who are in healthcare type professions, the health or the public health orders gives a date of September 30th, I believe. So why are we married to that date of September 28th? Because I know that the concern is getting it done so that it can go into effect. But if, I have my issues about the policy period, but if there's not saying that, like Jason said, we have to all be in agreement, but that's a pretty significant section of the policy that I think that we have to be in agreement in how it's written in the policy. So why do we have to push it to, make it by September 28th?
We don't. I mean, the rationale for the September 28th deadline is basically following the logic that if this is indeed a major public health issue, and if it is indeed a major health and safety issue, then implementing this sooner rather than later is in the best interest of everybody involved. The state of California's K-12 education policy mandating employee vaccination requires all school districts to be in compliance by no later than October 15th. So we felt like that was pretty well in line with the timeline that they had set forth. And because a lot of, our establishing act is the Education Act, in a lot of ways, we are very analogous to educational institutions. So that's the rationale behind it. I think that in order for us to authorize the director to go and figure out what this all looks like and what it costs and all of that, there needs to be a policy in place that says we're going to do this. Otherwise, I don't know that it's a reasonable expectation to undertake. So I think maybe one compromise. Oh, sorry. Everybody's all right. Maybe one option, as we sort of discussed, would be we could make an end run around this, and this is maybe a middle ground. In section 4, if we amended section 4 to say COVID-19 testing will follow a process and timeline to be determined by the ALD. And then we ask the director to bring back that process and timeline to our September meeting. That might solve it, because that doesn't say who pays for it. It doesn't say when you do it. It just says, we're going to tell you how it works. I don't know how you feel about that. What do you guys think?
I think we need more information on what it actually costs and where it actually happens and what the reality of all the logistics are to have a reasonable conversation about it. I mean, I think we can have a lot of supposition about what might or might not happen, but until we have some details in front of us, it's tough to have
a rigorous debate about it.
Katie, this is Nikki. I was
Yeah.
gonna say, I think it's a good plan because it's hard to develop a procedure when you don't know if a policy is gonna pass or not. So if the board is behind the policy, then we will put together a procedure, and being that it doesn't go into effect until after the board meeting, and maybe we extend that date out another week or something like that.
Right.
And I'll bring back what it's going to look like to the board before it even really goes into effect. You know, I think that might be the good plan.
What do you guys think about that?
Yeah.
I'm okay with that. It's not going to ultimately change my position on the matter, but as far as getting this policy approved tonight, I'm fine with that.
As well.
Okay, so then just to be clear, we've got an amendment to the motion, which has been made and properly seconded, namely that we have the clarifying language of the policy's intent in section 2, that we remove the references to masking in section 4, and that we strike from the second sentence of section 4, anything about cost to that sentence read instead, COVID-19 testing will follow a process and timeline determined by the ALD. And our intent is that the director should bring that process and timeline back to the board for approval at our September board meeting. And if it turns out that necessitates an extension of the timeline, we could so amend the policy at that time. Okay, that's the motion with the amendment. So I'm going to call the question. We're going to vote on that. Before we do, any further discussion or debate? Okay, we'll take a roll call vote. Trustee Andrews.
Aye.
Trustee Capel.
Aye.
Trustee Cervantes.
Aye.
Trustee Wilkerson. Trustee Wilkerson.
I'm going to say no.
Okay, and an aye vote from me. So by a vote of 4-1, the policy is approved. All right. That brings us to the end of our agendized business for this evening. I'd like to once again thank all of you for your thoughtful consideration and your feedback. And I'd like to thank all of our commenters this evening who participated. Trustee Cervantes, please.
Yes, and before we go our separate ways here this evening, I understand that is our director, Nikki Winslow's birthday today. So I want to make sure before we wish her a very happy birthday. And unfortunately, she's spending her birthday evening with us, but hopefully your day was nice.
Happy birthday, Nikki.
Happy
Happy birthday, Nikki.
Oh, she's ready to go out to dinner. Look at her.
Multitasking, that's what I do. Thank you guys very much. Appreciate it.
Thanks, everybody. All right.
Thanks.
Stay safe, everyone.
All right. Okay, then at 7:24, I will ask for a motion to adjourn.
So moved.
Okay, do I hear a second?
Second.
Any objection? All right, hearing none, we are adjourned at 7:25. Thanks so much, everybody.
Thanks, everybody. Bye-bye.
Bye-bye.